Hi, everybody. I'm going to go quick because I'm the last one. So we are making the first ever minimally invasive way to deliver oxygen when your lungs are not working. So right now, there's only two ways to get oxygen into your body when your lungs are not working, and they are both highly invasive. The first is mechanical ventilation. You have to be put into a coma to receive this treatment. And the harder the ventilator works, the worse your lungs do. There's about a 50% survival rate, so you could not say this is optimized yet. The only other treatment that there is something called VV ECMO. They pump all the blood out of your body into this oxygenator that's about that big. You get oxygenated and comes back in. Everyone's like, that sounds like dialysis. I'm like, yes, that's exactly like dialysis, except for instead of taking 3 hours to cycle all of your blood through, it takes 60 seconds. So it's very aggressive, and there's a lot of brain bleeds and other things that comes from moving that blood that quickly. So what we've done is we've taken the ECMO membrane, and we've worked for years at making it more and more and more efficient with the goal of fitting it inside the body. So our membrane sits inside the vena cava on a central line catheter. We've basically developed an artificial lung that sits inside your body. And it passively delivers oxygen to your blood as it returns to the heart. The other amazing thing about this technology is it's very simple to operate. You see just a single dial on that control box. So if you need more oxygen, you turn it up. If you need less, you turn it down. And that completely changes the paradigm for how this care is delivered to patients. Instead of having a big team whose career it is delivering oxygen to patients, people that are already in the ICU can deliver the oxygen. We're going after a very large market. We're going to start competing with ECMO, which is about a $500,000 market, $500 million market, excuse me, and then expand it to compete with the ventilator, which is a $4 billion market. We've had some recent funding successes. We've gotten a Seedron convertible note. We've gotten a BARDA contract. We've also gotten a DARPA contract. We're part of MedTech Innovator. We're very excited about that. We have our operations funded through mid-26. We'll be opening a round later this year, at the end of this year. We're still pretty early stage, so we've done some preclinical studies already. We're doing some more extensive preclinical studies in partnership with BARDA later this year. After we complete those, we will open our Series A with a goal of getting into first-in-human in 2027. We've got a great team working on this. This is my second startup that I've started from day one. I've also gotten 12 devices through the 510K process. My co-founder, Dr. Toby Straub, is in the ICU at Duke University Hospital. He's an expert in both mechanical ventilation and ECMO, deals with these patients every day. And we've got a number of other experienced team members that are on our board that have launched a number of medical devices and taken companies public before. So thank you all for your time, and I'd love to connect with you afterwards to talk more about our future fundraising.
Awesome.